Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care, providing effective solutions and promoting awareness about hair care in current scenario. With increasing bad lifestyle choices, poor stress management, and environmental pollution, hair problems now ranges from dryness, frizzy, breakage to dandruff, hair thinning and hair loss, and affect people of all ages and genders. And also it have a significant impact on self-esteem and overall quality of life. In this show, we aim to educate and empower individuals with knowledge and practical tips to overcome various health problems and achieve healthier and more beautiful outlooks. Today, we have with us Dr. Shwetal Rathi Sikchi is a well-known doctor based in Amravati. She has been practicing medicine for many years over now. She has been a part of prestigious hair care society and hence won various awards like Nail Physician Award from European Nail Society for her outstanding contribution in the field of medicine. Dr. Shwetal Rathi Sikchi has a wide variety of expertise in dermatosurgery, hair loss management, clinical dermatology, and laser. She has also keen interest in latest technology and research for hair and skincare treatment, and hence published articles internationally. Dr. Shwetal Rathi Sikchi is contingent for the patient awareness and education about hair care and spent a lot of time in giving talks at various platforms across the country. Thank you, Dr. Shwetal Rathi Sikchi, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show. डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So,
Thank you for the introduction.
So, doctor, today we are going to discuss hair care in current scenario. So, doctor, the hair loss is the most common problem which is faced by every one of us. So, what's normal and when to be concerned for?
See, hair loss is very much normal nowadays. And अगर आपको अगर बाल जाना है तो ये बहुत ही सीधी बात है, because हमारे जो बाल है उनकी भी एक लाइफ साइकिल होती है. It will come, then it will go only, right? So daily 50 to 100 hairs jana is very much normal. It is very normal if you're having hair loss and 50 to 100 hairs are going on the daily basis for a female. And for male, 50 to 60 hairs are normal. It will never be like that, not even a single hair is going. And it is not possible also. So you don't have to concern when only 10 to 20 hairs are going on a daily basis. अगर 100 से ज्यादा बाल आपके जाते हैं डेली, तो आपको थोड़ा बहुत उस पर ध्यान देना जरूरी है, क्योंकि आजकल एंड्रोजेनेटिक एलोपेशिया, जिसे हम मेल पैटर्न हेयर लॉस एंड फीमेल पैटर्न हेयर लॉस भी बोलते हैं, वो काफी जल्दी बढ़ रहा है, स्पेशली आफ्टर कोविड एंड स्ट्रेस की वजह से भी काफी चेंजेस आए हैं एंड एवरीवन इज फेसिंग द प्रॉब्लम ऑफ हेयर लॉस. सो वी हैव टू check the hairs properly, give proper nourishment to the hairs, because hairs adds a very much value on our face for everyone, especially in teenagers also. Nowadays hair loss is the very much important problem nowadays. Stress की वजह से भी होता है and plus आपके routine life की वजह से भी. So if only 50 hairs are going daily, it is very much normal. But if they are going continuously and more than 100 are going, then you should consult a dermatologist and see what is happening wrong and should correct it very nicely and perfectly.
Okay, so अगर more than 100 hair loss हो रहा है, तो it's time to visit the doctor and get the treatment.
Yes.
Okay. So doctor, when we are discussing about like इतना hair loss हो रहा है, youngsters भी face कर रहे हैं आजकल. So what are the general causes of hair loss? Why like?
See, the most important cause of hair.
Yes.
Yeah, the most important cause of hair loss nowadays is stress. There's so much stress. People are having physical stress as well as mental stress is also increasing. Especially after COVID, the hair loss has increased in a very high proportion. People are getting hair loss. प्लस जेनेटिक्स इज ऑल्सो अ फैक्टर। अगर आपके पापा को या दादाजी के भी अगर बाल गए हैं, तो ऑब्वियसली बॉयज के अंदर में मेल पैटर्न हेयर लॉस काफी इजीली दिखाई देता है। एंड प्लस अगर आपको कोई इलनेस है, लाइक यू आर सफरिंग फ्रॉम टाइफाइड या कोई वायरल इन्फेक्शन भी है, तो आफ्टर इन्फेक्शन यू कैन हैव हेयर लॉस फॉर 6 मंथ्स। 6 महीने से 1 साल तक बाल जाना इज वेरी नॉर्मल। सो कोई भी इन्फेक्शन हो, या फिर आपका जेनेटिक्स है, स्ट्रेस है, प्लस द मोस्ट इम्पॉर्टेंट थिंग इन फीमेल्स इज आयरन डिफिशियंसी एनीमिया, बिकॉज हेमोग्लोबिन लेवल्स कम होने की वजह से भी काफी हेयर लॉस होता है। Nutrition is the major factor nowadays, so proper nutrition is also important.
Okay, so like hair loss equally होता है मेल और फीमेल दोनों में, or just the female who's like face some more
It's
hair?
like मेल्स इतना ध्यान नहीं देते और फीमेल्स बहुत ध्यान देती है। प्लस द लेंथ ऑफ हेयर इज ऑल्सो डिफरेंट। अगर फीमेल्स के बाल गिरते हैं तो सबको दिखाई देते हैं, मेल्स के बाल इतने नजर में नहीं आते।
Okay,
बट
but
ऑब्वियसली बोथ हैव ऑलमोस्ट द सेम नंबर ऑफ हेयर फॉल।
okay. So, doctor, it's uh, as you said stress and all. So, does a person's lifestyle also play a role in hair loss?
Yes, personal lifestyle also play a very important role in hair loss, because अगर आपके lifestyle में proper nutrition नहीं है, you don't meditate or you don't have a relaxed lifestyle, if it is fully full of stress, so every time you're thinking about something or something is bothering you, also your body also get tired. So that also plays an important role in hair loss. प्लस आपका जो भी है, आपका खाना बोलिए, न्यूट्रिशन में आपको the food which are rich in biotin, vitamin B, there should be increase in the diet, so that you have a very good hair as well as your nutrition is also good. So proper जो हम लोग बोलते हैं ग्रीन लीफी वेजिटेबल्स जो है, साथ में खजूर होता है, डेट्स होते हैं, then we also have nuts, we have dry fruits, a lot of fruits should be increased in our diet.
So it's
And
a
plus one more thing, because yeah, one more thing, because it is a wedding season, a lot of people do a lot of hairstyles, a lot of straightening, smoothing, and everything. This all process also lead to hair loss in later times.
okay, okay,
Yeah.
okay. So, doctor, nutrition, hair treatment, hair loss कर देता है. So, is it like sleeping? Nowadays, we are all having like way late working hours, and don't sleep at all. So, does sleep also create hair loss, like improper sleep, or like is there something like that also? Like, does the sleep cycle also play a role in hair loss?
It is not, no, it is not like that. Sleep and hair loss are not related, but sleep indirectly आपकी stress से related होती है. And if you don't sleep for 7 to 8 hours daily, a peaceful sleep, then obviously आपका stress and दिन अच्छा नहीं जाता है, and you become very much like ये अच्छा नहीं लग रहा है, वो अच्छा नहीं लग रहा है, and your life becomes stressful, then you obviously have some chances of hair loss.
Okay, okay. And most of us are having like sedentary lifestyle. So is there anything like because of sedentary lifestyle also can we have a hair loss, or it's just okay to just follow the nutrition and stress free, and then we can avoid hair loss?
See, if you can do yoga or meditation for a few times, like it can increase the blood circulation over the scalp area. And if there's proper blood circulation, obviously it is always good for the hairs. So if you can add yoga at any time in the morning, evening, whatever time comfortable, it will be good for you. Okay.
Okay. So another question comes up into the mind after talking about lifestyle causes. So like if someone is already facing a hair loss, so what are the medical treatment options available for hair loss, like topical, surgical, or non-surgical, or is there some oral also, just eat and get the hair loss problem solved?
See what happened now in food, in whatever nutrition. If you're having hair loss, अगर आपके बाल बहुत जा ही रहे हैं, so obviously you have to take oral medication. because they will provide you proper nutrition. Nutrition proper रहेगा. साथ में we have different type of serums also. Like for topical application, hair growth के लिए serums होते हैं बहुत टाइप के, दवाइयाँ होती है. प्लस आजकल नई नई टेक्निक्स भी आ गई है. लाइक वी हैव PRP थेरेपी, वी हैव GFC थेरेपी for the hair growth, which we do particularly in androgenetic alopecia, which is male pattern hair loss and female pattern hair loss. Also, जिसमें हम बोलते हैं कि आप अगर बीमार हो और बाल जा रहे हैं, स्पेशली आफ्टर प्रेगनेंसी, many people have a lot of hair loss. That time you have telogen effluvium, जिसे हम बोलते हैं. So that time diet and medication is necessary. So you take proper medicine and which are having all the nutrients like आपका जो बायोटीन होता है which is very necessary, साथ में iron and everything. So the hair loss will be controlled within a period of 3 to 6 months. You have to take proper nutrition.
Mhm. And for example, if someone is already having a hair loss, and so is there any surgical or transplantation can be done to just have a good volume of hair?
Definitely, along with medication, we can do PRP therapy, जिसके अंदर हम blood लेते हैं, आप ही का, मतलब patients का हम blood लेंगे, and we prepare platelet-rich plasma, as well as now a new technique has arrived, which is GFC, जिसे हम growth factor components concentrates होते हैं, वो हम लोग आपको scalp में inject करते हैं, so that you have a good hair and the hair growth. And hair transplant is always an option because those males who have male pattern hair loss, hair transplant हमेशा कर ही सकते हैं. There's nothing, but you have to try always. You have to continue the medication so that the hair growth should be good.
Okay. Okay. And is there something topical also, like just apply and get?
There are many, yeah, there are many topical options also available,
They are
which you have
effective.
to apply.
Okay.
Yeah, they are effective.
Okay. Okay. So fine. So there are different kind of options are available, and we should visit to the doctor to get the right kind of treatment according to the problem which we are facing. So, doctor, nowadays another word is coming up into mind, like nutraceuticals. People are talking about nutraceuticals. So, what is nutraceuticals, and what is the role of nutraceuticals in hair health?
Nutraceuticals, first of all, what do you mean by nutraceuticals? They are the nutrients only which comes from food, right? So all the elements what we have from food like zinc, copper, all the elemental minerals, whatever we get, जो sources में वो ज्यादा है वो हम use करेंगे तो obviously they are good for hair, for the nutrition, because they provide, many of them are antioxidant. एंटीऑक्सीडेंट क्या करेंगे, वो जो बालों के बाल होते हैं वहां पे इन्फ्लेमेशन अगर है तो उसको रिड्यूस कर देंगे, सो दैट हेयर ग्रोथ विल बी प्रॉपर. So we can have nutraceuticals, but only in proper amount, not without consulting, because excess of nutraceuticals are also not good for your hairs or for your health actually.
Okay. So, whatever nutraceuticals you want to have, you should consult with the doctor and then take it instead of taking it by yourself and getting
Yeah,
over.
because whatever deficiency you have, we have to rule out first.
Okay. So, is there some test also to be done for these blood tests are also to be done before taking these nutraceuticals, or you just see the hair quality and let us know that okay, you might be having this deficiency, so you take the nutraceutical.
There are blood tests also which we do in severe cases, like vitamin B12 deficiency, vitamin D3 deficiency, CBC for seeing the hemoglobin level. All these are very essential. And in few cases, when the hair loss is not that severe, we check for the clinical sign of deficiency, and according to that, we give the prescription to the patient, the medicines.
So blood profiling is also important for the hair
Also
loss.
very important. Yes.
So, no, doctor, like we are talking about hair loss, and the most common word come out is like alopecia. So, what are the vitamins of what are some of the vitamins used in management of alopecia?
Biotin is the most common one, which is used in alopecia, as well as zinc, copper are also used, and iron, because iron deficiency can also lead to a lot of hair loss. So these all are very important.
Okay, so these vitamins um, can be taken by are like, for example, if someone is facing alopecia and they can take it by themselves. Okay, I'm having alopecia, I can take vitamins and get myself problem solved. So like for this also we need to visit the doctor, or it can be taken by prescribed to self prescription. Is it okay?
No. See, if you are having alopecia and you are having iron deficiency, but you are taking medicines for vitamin, biotin, it is not going to resolve. So whatever you have, it should be first known and then only you have to take medicine.
Okay. So, like when we're talking about vitamins, or the minerals also come into the mind. So, minerals like what kind of minerals also can help to promote the hair growth? Which minerals can?
Yeah, zinc, copper,
Okay.
these minerals are also useful for hair growth.
Okay. And for zinc and copper, can we like get it from the diet, or it's just again we have to go for some nutraceuticals and then we can fulfill our body requirement?
Zinc, and if you have fresh fruits and matlab in vegetables in your diet, and also for vitamins, like you can have daily a lemon soda or lemon juice like thing, then also you can have a lot of vitamin C from it. So all this thing you can add into your routine so that you can have antioxidants in your diet.
Okay. So
Fruits are very important, nuts and fruits. Yeah.
fruits and nuts are very important to fulfill the vitamins and minerals requirement. Okay, so like we are talking like self prescription should be avoided. So, is it required to take nutrients as per gender RDA requirement, or is just can you just enlighten us about this?
It should be taken according to RDA requirement only, because whatever it is you have to, मतलब जो भी आपके इसमें कम है या फिर properly amount में ही आना चाहिए. But if you have deficiency in vitamin D3, then it should be given according to your मतलब आपके प्रोफाइल को देखकर ही आपको देंगे.
Okay.
तो जो कम है वो प्रॉपर नॉर्मल होने के लिए, और जो नॉर्मल है उसको नॉर्मल रखने के लिए, यू कैन से
Okay.
by seeing your whole profile it should be taken.
Okay, so is it like differ like is this differ for male and female, or it's like requirement is same?
Requirement is almost same. There is not a lot of difference. Only few values are +2, -2 kind of stuff.
Mhm. Okay. So, like doctor, we have been talking about nutrients and lifestyle. So, what does what's the impact of stress on our hair health? Because we all are now, having stress. We can't get stress-free life. So, what is the impact of hair, like stress of on hair health, and how can we manage it?
First of all, you have to sleep nicely, eat nicely, don't take too much of stress, and don't put your hand too much into the hairs. Like many people have habit, like whenever they have stress, they just put their hands in the मतलब अपने हाथों को बालों में डालने की आदत बहुत लोगों को होती है. Most of the time stress के अंदर बार बार बालों में हाथ डालने की वजह से few people have a patch. एक ऐसे
Yeah.
पैच की हेयर लॉस भी डेवलप हो जाता है जिसको ट्राइकोटिलोमेनिया बोलते हैं. So you have a lot of stress, you can consult a doctor also to get rid of it so that वो बढ़े नहीं and you have a proper health. Health is more important than hair.
Okay.
That one thing you should also understand.
Okay, and some people also do scratching when they are stressed. So scratching can also.
Yeah,
Okay. So
एग्जैक्टली आपके रूट्स जो होते हैं, हेयर रूट, वो वीक हो जाते हैं व्हेन यू आर कंटिन्यूस स्क्रैचिंग.
okay.
लाइक मेनी पीपल आस्क कि डैंड्रफ से हेयर लॉस होता है क्या मैम? डैंड्रफ नेवर कॉजेस हेयर लॉस, बट द इचिंग कॉज बाय डैंड्रफ, उसकी वजह से आपका हेयर लॉस होता
Okay. Okay. So scratching your hair again and again should be avoided, and also stop touching your hair again and again if you are
है.
stressed.
Yeah.
Okay. So, like we are talking about stress and scratching, and also another thing comes up to our mind is like, if you like at our homes when we are stressed, okay, we think about, okay, we can get our hair massage and also and we do the massage by oiling. So oiling is a ban or a boon for hair health?
सी बचपन से हम लोगों ने सुना है कि तेल लगाओगे बाल बढ़ेंगे.
हाँ.
मम्मी लोग बचपन से सभी को तेल लगाती है, राइट? बट व्हाट हैपन ना, एक्सेसिव ऑयल इज नॉट नेसेसरी. हमारा जो स्काल्प है वो पहले ही ऑयल खुद सिक्रीट कर देता है. तो अगर आप ज्यादा ऑयल लगाएंगे तो डैंड्रफ ज्यादा होगा. प्लस ज्यादा ऑयल आपके अगर फेस पे ड्रिप करता है तो वो एक्ने होने के भी चांसेस बहुत होते हैं. इट्स नॉट लाइक ऑयल इज बैड, बट इफ यू वांट टू अप्लाई ऑयल, आप हफ्ते में 1 या 2 बार जब भी आप हेयर वॉश करते हैं उसके प्रीवियस नाइट ऑयल मसाज कर सकते हैं, एंड यू कैन अप्लाई ऑयल. और अगर आपको डेली ऑयल लगाने की आदत है, लाइक नहीं लगाओ तो अच्छा नहीं लगता, तो आप स्कैल्प पे मत लगाइए, सिर्फ हेयर्स के ऊपर लगाइए. डोंट अप्लाई ओवर द स्कैल्प.
ओके. ओके. हेयर्स मतलब हेयर शाफ्ट पे लगा लो अपना.
या सो दैट यू हैव लाइक थोड़ा सा शाइनीनेस एंड एवरीथिंग. बट अगर आप प्रॉपरली उसको स्कैल्प पे लगाएंगे तो फॉलिकल्स ब्लॉक होते हैं उससे, एंड डैंड्रफ बढ़ता है.
So nowadays, like the serum are also coming, like instead of oil, applies this serum. So are they serum or not oil, or like serums can be applied without thinking about hair loss?
See, serums have many of the plant-based elements also nowadays, which are there, which promote hair growth.
Okay.
Right? In serum form, if someone prescribe you a serum, you should not apply any serum blindly. कोई भी सीरम उठा के नहीं लगाना है. आप जो भी सीरम लगाते हैं उसके अंदर प्रॉपर कंटेंट्स होने चाहिए जो हेयर ग्रोथ को स्टिमुलेट करते हैं. एंड ऑल्सो सीरम यू आर नॉट गोइंग टू अप्लाई फॉर द डेली बेसिस. ओनली आपके हेयर ग्रोथ प्रॉपर होती है तब तक, एंड देन अल्टरनेट डे काइंड ऑफ स्टफ यू हैव टू अप्लाई द सीरम.
Okay. 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 But serum can be applied alternatively and for the hair growth.
Yeah, for the hair growth, but having a proper contents in it which are required for your hair.
Okay, so it like for serum also we should take the doctor advice and then apply it instead of blindly going for this serum, that serum, and just
Yeah, because serum also should be applied for a period of at least 3 to 6 months continuously. So always you should take a advice properly.
okay. Okay. So, doctor, like what are the important tips would you like to give for the healthy hair?
For the healthy hair, have more fruits and nuts in your diet. Also, don't बार बार बाल नहीं बनाने चाहिए. Many
Okay.
people have a habit, जाकर बाल बनाओ, वापस बाल बनाओ, फिर देखो कितने चले गए. And mostly teenagers have this habit. पढ़ते पढ़ते उठते हैं और जाकर बाल बनाते हैं. And they sit again. So बार बार बाल नहीं बनाने चाहिए. Second thing, whenever you have a hair wash, first बाल बनाइए. जितने भी उसके अंदर tangles है उसको आप पहले ही remove कर लीजिए. And then have a hair wash. Apply the conditioner. And if you can apply also the hair moisturizers are also there. You can apply them so that frizzy नहीं होंगे बाल. And they will be smooth. Straightening, blow drying, smoothing should be avoided because they remove the water from your hairs. जब करते हैं तब बहुत शाइनी लगते हैं, बाद में वो पूरे एकदम बहुत ही फ्रीजी हो जाते हैं. तो इट शुड बी अवॉइडेड बिकॉज हेयर लॉस उसके बाद में काफी बढ़ जाता है. परमानेंट स्ट्रेटनिंग शुड बी अवॉइडेड वेरी
Okay.
स्ट्रिक्टली. या
Okay, so permanent straightening and all should be avoided. Even if you want to, please avoid it because it can create hair loss. Okay,
या
doctor. This discussion was very informative, and I'm sure our viewers would be benefited by it. So, Doctor, can we take some questions from the live audience now?
Definitely, yeah.
So, okay. Okay, the first viewer asked us, are some home remedies as effective as professional treatment for hair fall or hair loss?
See, which kind of home remedies आप कौन सी यूज कर रहे हैं वो भी जरूरी है. If you are applying, many people apply curd over the hair with the eggs so that मतलब प्रोटीन्स मिलेगा ऐसे करके. ऑब्वियसली कर्ड लगाने के बाद में थोड़ा सा स्मूथ हो जाते हैं बाल स्लाइटली. So you, if you want to apply curd, that is okay, but not very frequently. पर जो बाहर से जो मेडिकेटेड रेमेडीज होती है, दे एक्ट ऑन द फॉलिकल.
Okay.
वो फॉलिकल पे एक्ट करके हेयर ग्रोथ को प्रमोट करेंगे. So obviously I'll prefer medicated one more than the home remedy.
Okay, so some people also try to apply like dandruff होता है तो lemon and onions लगा लो. So is it
Yes.
like permitted or
No, no,
okay?
no, no. This will irritate your skin also.
Okay. Okay, so
बहुत
what?
लोगों को सेंसिटिव स्किन होता है, तो वो स्किन पे अगर आप वो लगाएंगे तो वो इरिटेशन भी बहुत हो जाता है कभी कभी.
Okay, so if you are having dandruff also, then also we should get the professional treatment done, or what we can do?
एंटी डैंड्रफ शैम्पू शुड बी स्टार्टेड
Okay, okay, okay.
फर्स्ट ऑफ ऑल. एंड आफ्टर दैट अगर डैंड्रफ बहुत ही ज्यादा है तो वी हैव टू चेक वेदर इट इज डैंड्रफ or whether it can be seborrheic dermatitis also, or it can be a part of SIBO psoriasis also in few patients. So we have
Okay,
to check whether कि क्या है exactly and accordingly treat करना चाहिए.
okay. Okay. Our second viewer is asking, मैम genetic hair loss को कितने समय तक रोक सकते हैं? Like family history अगर किसी को है और उसको अवॉइड करना है कि उसको भी वो प्रॉब्लम ना आए, तो क्या कर सकता है? वो कितने समय तक रोक सकता है उसको?
जैसे मेल्स के अंदर सबसे ज्यादा प्रॉब्लम होती है कि अगर पापा के बाल गए हैं तो बच्चे के भी जाने शुरू हो जाते हैं मोस्टली. तो उसके लिए हम लोग एंड्रोजेनेटिक एलोपेशिया बोलते हैं उसमें. तो हम लोग उसमें टैबलेट देते हैं, सीरम भी देते हैं, प्लस वी डू ऑल्सो PRP, GFC. हम उसे रोक सकते हैं. लाइक यू कैन ऑलरेडी यू कैन टेक मेडिसिन, यू कैन स्टॉप द, यू कैन नेवर रिवर्स जेनेटिक्स. जेनेटिक्स आर वेरी स्ट्रॉन्ग. आगे जाके कभी ना कभी हेयर लॉस हो सकता है, बट इफ यू टेक प्रॉपर मेडिसिन 6 months to 1 year, तो ऑब्वियसली आपका जो रहेगा, जो अभी बाल जाने वाले हैं वो एटलीस्ट 4-5 years तक यू कैन जस्ट सेव योर हेयर.
Okay.
एंड इन बिटवीन इफ यू टेक मेंटेनेंस डोजेस तो काफी टाइम तक यू कैन हैव अ गुड हेयर.
Okay, so someone's fathers have a alopecia. So when the son should, visit to the doctor, when is the, appropriate time that, okay, I should take the treatment to avoid this condition?
या एज अर्ली एज पॉसिबल. जैसे जैसे ही आप पेशेंट को लगता है कि हेयर लाइन पीछे पीछे जा रही है फॉर अ मेल, राइट. मेल पैटर्न एंड फीमेल पैटर्न आर डिफरेंट. मेल पैटर्न के अंदर हेयर लाइन पीछे पीछे जाती है. समटाइम्स ओवर द वर्टेक्स एरिया, लाइक एकदम यहाँ पर सम पीपल कैन सी कि हेयर थिन हो रहे हैं, स्कैल्प विजिबल हो रहा है, तो उनको ट्रीटमेंट शुरू कर देना चाहिए. एंड फॉर द फीमेल, अगर हेयर लाइन ब्रॉड हो रही है, फीमेल्स का कभी भी हेयर लाइन पीछे पीछे नहीं जाता.
Okay.
उनके सेंट्रल एरिया से बाल पतले पतले होते हैं एंड देन स्कैल्प विजिबल होने लगता है, राइट. तो उस टाइम पे उन लोगों ने भी ट्रीटमेंट शुरू कर देनी चाहिए, बिकॉज जेनेटिक सिर्फ मेल्स का नहीं होता, फीमेल ऑल्सो हैव दिस फीमेल पैटर्न हेयर लॉस वेरी है.
Yeah. Yeah. The third, our viewer is asking the question, very interesting. Can I take hair spa every month? My hair feels frizzy, free for a few days afterwards. Hair spa really good for my hair or not?
नो, हेयर स्पा हमेशा नहीं लेना चाहिए, बिकॉज इन हेयर स्पा ऑल्सो यू आर हीटिंग योर हेयर. whenever there is heat, the water in the hair is get lost, and the shininess जो आता है वो थोड़ी देर के लिए रहता है. So you can have, if you want, you can add a hair moisturizer, a good conditioner, and a good serum in your hair routine, and that will help you more.
Okay, okay. So instead of hair spa, you use a good shampoo and a conditioner and a serum as a nutrient to your hair.
Yeah.
Another question is, hi ma'am, can you tell me about, can less sleep cause hair fall?
If you are not stressed, तो फिर नहीं होगा. Just don't be stressed. Yeah.
एग्जाम है, आधी रात तक पढ़ रहे हैं तो भी चलेगा, बट अगर स्ट्रेस है तो नहीं चलेगा.
Yeah.
Okay. So another interesting question is how to choose the best anti-hair fall shampoo.
For the anti-hair fall shampoo, like you have to decide first कि what kind of hairs you have. Oily hair, dry hair, किस type के है, आपको dandruff है, नहीं है, and what is the cause of hair fall. शैम्पू से कभी हेयर फॉल रुकेगा नहीं. इफ यू हैव, अगर आप में आयरन कम है, लाइक हीमोग्लोबिन कम है, तो यू हैव टू टेक आयरन सप्लीमेंट्स फर्स्ट. शैम्पू इज नॉट दैट मच ऑफ इम्पोर्टेंट.
Okay.
Just for the shininess and for the good hairs, you can have a anti-hair fall shampoo for sure, but hair shampoo doesn't have that much effect on the hair fall.
Okay. Okay. So
Yeah.
hair. Okay. Okay. So might be the viewer is clear. Another question is it possible to reverse hair damage due to heat? Yeah, this I also want to know.
Yeah, because of heat, a lot of hair is damaged. So you can apply, uh, you can like हफ्ते में 2 बार you can do oiling for the hair, and in the morning you can have hair wash. Hair wash के बाद apply a proper conditioner, a proper hair moisturizer, and also there are few serum for the hair shaft also.
Okay.
Like for this hairs also there are few serums are there जो आपको scalp में नहीं apply करने पड़ेगी, shaft पे करने पड़ेगी for their
Okay.
proper nutrition.
Okay.
And आप आपके डाइट के अंदर भी थोड़ा सा सप्लीमेंट्स ले सकते हैं for the good hair, and that's how you can manage it.
Okay. So you can reverse the damage caused by the heat.
Yeah, but it takes time.
Yeah, yeah. Every good thing takes time. So, Doctor, another interesting question is, what is hair botox? This name is really, getting a lot of focus nowadays. Hair botox. What is it?
Actually hair botox in our हमारे मेडिकल फील्ड में हेयर बोटॉक्स का इतना कोई इम्पोर्टेंस नहीं है. Actually it is a not kind of a botulinum toxin
Okay.
which
Okay.
we usually do for anti-aging stuff. That's we know, that is known botox for us. Hair botox आजकल पार्लर्स में काफी चल रहा है. And if you go for a good like saloon or something like that, there we have hair botox, but it is like a hair straightening or smoothing like thing only.
Okay.
They
Okay.
just apply few nutrients and just do the straightening stuff.
So it's kind of a heat treatment only. So
Yeah, kind of.
okay. So it's better to avoid it.
Yeah, it is like a permanent straightening kind of condition only. मतलब उसके अंदर भी कुछ टाइम के लिए बाल सिल्की और कंडीशन रहेंगे ऐसा बोल.
Okay. Okay. Another question is very interesting. मैम मेरे बाल ऑयली ही रहते हैं, मैं फिर भी ऑयल लगाना चाहती हूँ, मैं क्या करूँ?
शाफ्ट पे लगाइए, स्कैल्प पे मत लगाइए. Yeah.
Okay, okay. So we are running out of time. So I'll ask you the last question from our viewers. He's saying that I get the split ends and I cut them. Still, the split ends comes up. Why the split ends comes up?
हाँ, सी अगर आपने बहुत बार स्ट्रेटनिंग किया है and many times you have doing blow drying or else you have iron deficiency anemia, that time split ends बहुत ज्यादा होते हैं because hair में उतना strength नहीं होता है, that's why वो split हो जाते हैं. So properly first check your iron, whether you have iron deficiency, hemoglobin check करके iron deficiency anemia होगा तो correct it, then it will get reduced.
Okay. This viewer is asking me, please, mera question पूछ लो. Okay, I'll ask her questions. Okay, she's been asking 2-3 questions back to back. She said that she has recently delivered a baby, and she is having a lot of hair loss. So, is it because of a delivery or something else?
सी इन प्रेगनेंसी क्या होता है, बहुत सारे हार्मोनल चेंजेस होते हैं. फ्यू हार्मोन का इंक्रीज, और वो हार्मोन्स जो रहते हैं वो बालों को पकड़ कर रखते हैं. सो यू मीन आपको प्रेगनेंसी में लग रहा होगा कि आपके बाल तो बहुत अच्छे हो गए, यू हैव अ सो स्ट्रॉन्ग हेयर, आपके बाल घने हो गए हैं, पर सडनली डिलीवरी होने के बाद में दैट हार्मोन्स केम बैक टू नॉर्मल लेवल. तो सडनली जितने बाल होल्ड किए हुए होते हैं विद इन प्रेगनेंसी पीरियड वो सडनली एक साथ फॉल हो जाते हैं. So that we known as pregnancy-induced telogen effluvium. So nothing to worry, they all will come back to you. बाल वापस आ जाते हैं, but आपके हेयर फॉल अभी next 6 months to 1 year तक रहेगा.
Okay.
So if it is more than 100, 200, then you can start supplements, but nothing to worry about. It is because of the pregnancy only.
Okay. She's asking another question that डॉक्टर ने मुझे मिनॉक्सिडिल प्रेस्क्राइब किया है, मैं कितने समय तक उसको लगाऊं?
अगर आपको कुछ प्रॉब्लम नहीं हो रहा है मिनॉक्सिडिल से, लाइक यू आर नॉट हैविंग हेडेक और समथिंग, यू कैन अप्लाई मिनॉक्सिडिल कंटिन्यूअसली फॉर 8 months, 8 to 12 months.
Okay. So now the last question from her. मैम आपने PRP बोला, लेकिन मैंने किसी से सुना GFP. So GFP बेस्ट है या PRP?
See, PRP and GFP are both are good at their own thing. Usually we do a customized thing जिसके अंदर हम दोनों भी करते हैं. Like we do PRP and GFP together also, जिनमें बहुत severe होता है. GFP के अंदर few added nutrients are there apart from PRP. So if you want to rank me, so GFC is slightly better than PRP, but in few patients PRP works excellently because I have been doing PRP since long. So I never compare both, but if I want to do in जहाँ बहुत ज्यादा hair loss है, I prefer GFC, and if it is slightly less, I prefer PRP.
Okay. So even like she was pregnant and she just delivered the baby. So even the post delivery women can also go for PRP and GFP the same.
Yeah, because there's बाहर से कोई भी दवाई नहीं होती उसके अंदर. You're not adding anything. आप उन्हीं का blood लेते हैं, we prepare from it and we inject it.
Okay.
Right? So side effects are very few, and usually after pregnancy वैसे भी hair fall होने ही वाला है for the 6 months. You should add supplements, और अगर कम करना है, we want healthy hair, we can go for PRP more after pregnancy than GHC.
Okay. So, Doctor, would you like to give some take-home messages or any suggestion to our viewers today?
It's like hair loss is very normal. Everyone is getting hair loss. Just don't get बहुत ज़्यादा stress नहीं लेना है because of hair loss. And whatever is the issue, you can always consult your doctor and get the proper treatment done.
Okay, so nutrients and proper sleep, stress-free life, and regular consultancy from the doctor can have a healthy hair. Thank you, Doctor, for sharing so much of information and all your expertise with us today, and for answering all the questions of our viewers. I am sure viewers have found this session very helpful. Thank you, Doctor. It was a delight to have you, and thank you so much for your valuable time. Thank you,
so
ladies and
much.
gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today.